There's a study by University of Utah that in the last 2 decades, ADHD has gone up from somewhere around 6% to 10%.
Mm-hmm.
So it's not just that we're being diagnosed, but there seems to be an actual rise in ADHD. What do you think is the biggest explanation or cause of that?
Yeah, I think it's multifactorial. So one is recognition, right? So you can't measure something if you don't detect it, right? Or you don't know to look for it. So I think about, my generation growing up. I have ADHD myself, and I wasn't diagnosed until adulthood, even though in hindsight, all the symptoms were there, but it just wasn't as recognized. I think now I'd probably be diagnosed much more quickly. ADHD is largely genetic. So when we think about where does ADHD come from, there's this thing called heritability. Heritability ranges from a score of 0 to 1. 0 means genetics have nothing to do with it. 1 means genetics are the only cause for acquiring that condition. For ADHD, the heritability score is between 0.7 and 0.9. So it's highly genetic, but not exclusively, right? So there's still 10 to 30% of other factors that can contribute to acquiring ADHD, but also if you have ADHD, having it be much more noticeable or visible. And that's where the nuance comes in. I think of ADHD as ultimately a supply-demand issue, right? Is blood flow supply to the prefrontal cortex, the front of the brain, keeping up with the demands that are being placed on it? And anything that alters that equation, anything that reduces supply or increases demand, can make someone who has ADHD have ADHD that's much more visible or apparent. And then someone who doesn't have ADHD start looking like they do, right? And examples of things that reduce supply. Technology is one example. And I'm not anti, social media. I post on social media almost on a daily basis. But at the same time, the average video length that I post is like a minute to a minute and a half. The average watch time is 7 seconds. And it's because as a society, we've gotten really used to scrolling, right? And moving past, and get the dopamine hit. Okay, great. What's the next thing? What's the next thing? What's the next thing? That affects kids too, just like it does adults. And whenever someone is engaging with, it's not just social media, it could be video games, it could be other forms of technology, short video. That is a dopamine dumping ground, right? And if you dump all of your dopamine in that setting, and then you try to transition to something else that requires your attention that might not be as interesting, like let's say homework, it becomes so much harder to lock in and focus. So that's one example of something that can affect supply. There's others too. Depression. When brains are depressed, they send less blood to the front. And so now it's harder to focus. Head injury. If you sustain a head injury anywhere, your brain ends up wobbling back and forth within your skull, and that prefrontal cortex can take a hit. And there's so many people with undiagnosed head injuries, and they think, I haven't had a head injury because I wasn't concussed and passed out for 5 minutes. But even soccer players who go for headers over and over, you can see changes on a scan. And then things that increase demand also, right? As life gets more complicated, as we're multitasking, as we have so many obligations and responsibilities, that might at some point exceed the prefrontal cortex's ability to keep up. So it's a long-winded, nuanced answer, but I think the reason it's on the rise is better detection, but then also more demands on our brains than before, and also more dopamine drainers than before.
Yeah, talk to me about those dopamine drainers. That's one that's something that I think about a lot, because it seems like anything, you build up a tolerance of a certain amount of dopamine in this case, and to hit the same level of satisfaction, you need more of it.
Yes.
And that bar keeps raising and raising and raising. And this is kind of this treadmill that we're on right now, right? What is that doing to our brains?
Such a good question. So I'll give you the nitty-gritty scientific answer and then kind of like the big picture answer. Yeah. So on a biological level, here's what's happening. There's a part of the brain called the basal ganglia, and it's deep inside our brain. And the basal ganglia, they function for a couple different purposes. One is they're sort of like the fight or flight centers. They're important for modulating anxiety response, but they're also the addiction centers. And the reason for that is there's a tiny part within the basal ganglia called the nucleus accumbens, and its job is to release dopamine when we do something that feels good. Okay, so dopamine gets released, our whole brain feels it, and it feels good, right? And so we keep doing whatever that thing is. But now fast forward, let's say a couple months or a few months, the dopamine release is less than before because we're building up a tolerance. And when we don't do it, when we're not engaged in whatever the activity is, our dopamine level doesn't drop back down to where it had been. It drops down lower because our whole dopamine system is being hijacked and recalibrating. And so when you have the next dopamine spike from doing whatever the activity is, it's a little bit less than before. But when you drop back down, you drop a little bit lower than before. And eventually, if you play that out long enough, what happens? The dopamine spike is only getting you to feeling normal. And then when you're not engaging in the activity, you feel worse than ever before. And so the story that we end up telling ourselves is, I need that thing to feel normal. If I don't have that thing, I'm miserable. It's the only thing that works for me. It's the only thing that helps me. And that feels true in the moment because that's what's hijacked your brain. As a rule, anything that gives us dopamine quickly without having to work hard for it will eventually lead to that. Gambling, sex addiction, video game addiction, social media addiction, substances, nicotine, cannabis, alcohol, you name it, sugar even, it'll follow the same pattern.
And how fluid is that? Meaning, how we can reset our metabolism, let's say, after a certain amount of time. Can the same be done with dopamine? For example, if you, like I did a 3-day dark retreat last year where I had no food, no technology, obviously, no light. And I came out of it feeling sensitive to everything. Just even like lights and notifications, it was just too much. And to me, I felt, I don't have any data. I would love to actually, it's probably a good SPECT scan to do.
It'd be so cool to scan you before and after that.
Totally. Yeah. And I felt there was some sort of a reset, perhaps anecdotally. But is there a fluidity in terms of these dopamine reset? And can we reset that? And how do we do that?
Sobriety off of whatever the dopamine drainer was or is, and that's what you did in that 3-day fast. And usually it'll take longer than 3 days to rebuild a dopamine system. Often when I'm doing repeat scans on people, I'm waiting 6 months, before getting a repeat image. And could you see changes earlier than that? Sure. But the brain does take a while to remodel. And so I'm a fan of putting in the consistent work and then checking, right, to see what the result is. But the only way to reset a dopamine system that's been hijacked is to move away from the thing that hijacked it.
Got it. And there's no real data yet from what you've seen around how long that takes to reset?
I don't think I could give a specific, exact time. And I imagine that it's going to be different depending on what the agent is that was draining your dopamine to begin with, and how potently it was draining it, and how much the person was doing it, and were there other sources of dopamine drainers too? So I think it's going to be a little different for each person, which is why I tend to lean towards 6 months as a nice general rule.
Got it. I don't know how much research there is now on these GLP-1s that have come out. Obviously, this is a very hot topic with Ozempic, Wegovy, and all these things. And from the research that I've seen is that it's pretty much dulling or blunting some of these reward circuitries in our brains, including dopamine. Are you a fan of GLP-1 when it comes to helping people deal with dopamine fast and stuff like that?
I think in the right person, it can be a tool. I mean, as a general approach for me, I'm not anti-medication. I think medication can be a tool when it's used responsibly, in the right person and the right brain assuming other things have been tried as well. But for GLPs specifically, you're right. Their primary mechanism of action is by regulating dopamine transmission.